So the health studies major, it's initially what I was going in for, and because I wanted to create an impact in change in the healthcare system, as well as address issues, especially with marginalized communities, and come with a perspective of advocacy and empathy.
For me, the passion grew with my intro teacher. She really made the major something that I still wanted to be a part of. Public health, that whole term scared me. I didn't really know what it was, what it meant, and she gave us an overview of what it all had in it. So that really made me want to be a part of it more.
Health Studies provides a very nice foundation of public health education, and it weaves into it some nice information on social determinants of health with a social justice focus.
I personally wanted to be a manager for the hospital and healthcare field. So I took all of my elective credit focus on the management area. So I have about a couple of classes focused on healthcare management, while a couple more classes focused on business and healthcare. It kind of helped me understand a little bit more of the concept and how public health related to hospital field and connect them together. I think I have a perfect prepare for my future.
One of the wonderful things about our classes is that most classes are capped at around 48 students. It allows an opportunity for faculty to really get to know their students and for good interaction between students and faculty and between the students themselves. So it allows for good group discussion and a lot of engagement.
Size of the classes definitely was a deciding factor for me in coming to UW-Bothell. I always felt included in discussions, and when I set up time with my professors, they knew who I was, they knew what class I was in, I didn't have to explain to them, and I felt like that was just super comforting.
It's been a great opportunity to work with communities I wouldn't necessarily work with. I've been able to talk with different instructors, talk with students, and just kind of see how they're navigating through the world and what obstacles they have to overcome within our health system.
One thing I've learned, especially from my professors as well, and from my fieldwork events, is school is, it's not the traditional 4 years and just graduating. It can be whatever you want it to be.
I would recommend just taking the intro class or taking a health class in general if you have any kind of interest in being in health. If you don't know if you want to be a doctor or if you want to be on the administrative end of health, just try it out, see what it's about for you, and if you end up taking that class for the quarter and you find just one thing that really grabs your attention, the degree's for you. That's what happened with me.